Okay, so we're going to look at now methods of assessment. So we looked at anthropometrics before. Now we're going to look at straight up body composition and look at how do we interpret these results. So like I said before, we don't do any direct assessment that would lead to destruction of the tissue. And so we're left with indirect assessments. And there's 7 of them listed here. Some of them are the gold standard coming out. We'll talk about a few of them, but we'll focus on the 3 that we're going to do in class. So underwater Weighin was the gold standard for a long time, and I still think it is the gold standard, but I think it's being replaced by the DEXA scan we'll talk about in a second. But basically what it is that there's a buoyancy effect, that you float. The fatter you are, the more you float. So the leaner you are, the more you sink because of the density of fat tissue to muscle tissue. So if I measure myself underwater and I compare it to dry land and it's significantly lighter, then I'm fat. If it's about the same, then I'm lean. That's basically the nuts and bolts of underwater weight. You're just comparatively, you're looking at your dry land weight to underwater weight, and you're calculating that based on formulas that were derived. The one that's really popular right now, but still has a pretty big margin of error, except for some technology, is this thing called bioelectric impedance. And it's basically fat tissue insulates, and lean body mass, because it's water, will transmit a current. So this current then is coming from the lean body mass. The faster that it reaches the endpoint, the leaner you are, the more resistance you hit, the fatter you are. And so this machine that we have on our right, we actually have in our lab, and this has been validated against underwater Weighin and different measurements, and it's pretty spot on. So it's on par with underwater Weighin right now. So it's pretty good. So we have one in our lab. We'll be using it, and we can use it. But it basically visualizes the body as like that red Tin Man there, these cylindrical aspects. And what it's doing, it's putting current through, and it's just measuring that resistance, that impedance. How long does it take to go from one aspect and close that circuit, and then go through the arms or through the legs. And that's what this unit does, is you actually stand on that and you see those metal plates, metal receptors, conductors on there, and then you hold those handhold things, and it measures the current. These ones are garbage, but they're very popular because they're about $20. This machine here is about $2,000, maybe more, and this machine here is about $20. So these are really popular, super easy to use. We have a few of them, and they're sensitive to like your hydration status and what you worked out before, and you know, they're just really, they're inconsistent. For $20, it's not a really calibrated piece of equipment. Now for $20,000, you have a machine that's straight out of Star Trek, right? It's basically a scanner that's scanning you, and no, it doesn't tell you anything that's wrong with you, but it's basically using low dose radiation, X-ray, and it's used quite a bit for, where it was intended for was for bone mineral density. So it's looking at the different density to see, do you have bone mineral loss or bone mineral gain? But since it measures density, and we said earlier that muscle tissue and fat tissues have different densities, it's becoming a very effective way at separating fat tissue versus muscle tissue. It's actually a 3-compartment model: bone, fat, and fat-free mass. And it's, like I said, usually found in the clinical setting. You can see here on the left and right the bone scan and then the tissue scan to see the body composition. These images that I showed earlier, these were generated from DEXA scanning and then superimposed. But like I said, it's usually found in the clinical setting. These are the new update. And yeah, you lay on this machine, this thing just kind of goes over you. The problem is that it does generate some radiation. So low dose, about the same amount that you would go through those scanners at the airport, maybe a little bit more. Radiation is radiation, so I don't know if I would be messing around with that. But I think it's becoming the gold standard because it's really effective. And all the patient has to do is just lay there, and you push a button, and it does that. So what do we have available to us? We have the pinch and inch method, right? So let's see how fat we are by pinching the subcutaneous fat and guessing. Well, actually, we measure. And this is not, I guess, not as good image on the video as it was when I found it, but we're using a pair of calipers right here. And these calipers are about $200. Calipers on the left are about $20, and the calipers on the right are about $320. I gotta be honest with you, I use the ones on the left, the Slim Guide, all the time, and they're amazing. The only difference is that the spring gets calibrated and gets off a little bit, but we have some of the Harpenders and the Lang calipers, and we got to get them calibrated every so often, and it costs us almost $20 or $30 to get them calibrated. The Slim Guides are about $19. They're mostly plastic and the metal, so we put those in the recycle bin and just buy a new set every year. You don't have to do that, but they're pretty effective. But you're basically taking the caliper, you're opening up the jaws, and it's measuring the distance of what you put in there. In this case, a pinch. And what you're doing is you're taking a pinch of the skin, you're doubling it in half, and you're getting a direct measure of a double skin fold, right? So a direct measure, because you're measuring just that skin fold thickness. And you can see what you're doing here is you're taking that skin, you're pulling back, and it's measuring, and you are getting, so let's say you measured 20 millimeters in this situation. You know the distance from the bottom of your fascia to the outside of your skin is 10 millimeters because you measured 20 and you're getting half and half, 10 and 10. So that's a skin fold assessment. It's super simple, based on super simple premise, but it's highly dependent upon practitioner skill. The ability to kind of get the skin fold, pull it away from the body. It takes time, and it is, like I said, it's highly dependent upon technical competency, so it can introduce a lot of operator error. Now, you're not taking random skin folds of the body. What you're doing, there's 7 standard sites, and then there's 9 total. And these are the 7 plus the 2. This image is in the Blackboard shell and on the EXRX website, and then in your textbook. The sites for men and women are about the same. The only difference is site number 2 up at the pec, at the armpit there, and it's just slightly different, halfway versus a third of the way. But we'll discuss that in class. So that is skin fold, and like I said, this will be your bread and butter for skin fold assessment, and we'll talk about data interpretation, and we'll be practicing this in lab.